Manjuna, shall we start?
Namaste, this is Manjunath Murthy from Know Your Yoga. As we gear up to celebrate the 6th International Day of Yoga, let us take a few minutes to reflect upon what can be done differently yet effectively in the context of ongoing pandemic. Every year, most yoga practitioners follow a certain routine like getting together in large groups, often in open spaces, and perform the yoga protocol or 108 Surya Namaskaras. This year, due to social distancing and other restrictions, people are advised to practice in smaller groups or practice at home. But isn't yoga a lot more than just practicing asanas, kriyas, and pranayama? How else can we celebrate Yoga Day, which is now celebrated by more than 84 nations? Yoga is considered a science, a way of living, a means to peace, a way to spirituality, among many other things. Even from centuries before, people have been following this ancient knowledge, and if we trace its history, we often have seen great people mentioning or quoting sentences from scriptures and texts of yoga. Fast forward to the present, yoga has become part of medicine, health, nutrition, psychology, counseling, sports, education, fitness, the list goes on. Such is the power of yoga. Yet most of us make use of yoga in a limited way. Sure, there are people who have adopted it as a lifestyle, but strides have not been made to dig deeper about the core and essence of yoga. For this reason, we present an ongoing series known as Kaapi with Yogi, where Sri Subbu Bhaiya, a yogi himself and guru to myself and many, interviews great stalwarts from different fields of work who have successfully blended yoga into their work, thereby educating and helping others. So let's not miss this opportunity to know more about the length and depth of yoga and enhance our own personal yoga journey. We go live at 8.
Thank you. My dear Yoga Mitras, welcome you all for the episode 11 on the series of Kaapi with a Yogi. Today we have a Yogini with us, Dr. Meena Ramanathan, Yoga Chairman Dr. Meena Ramanathan from CITE, that is Center for Yoga Therapy Education and Research from Balaji Vidyapeetham, Pondicherry. Welcome Dr. Meena Ramanathan for the show today. Welcome, madam.
Namaste, Vandanam, Swagatam, and good evening to all of you. And thank you, Subbu Bhaiya, for having me here. And let me just tell you one compliment. Every day, when I open this Yogi with Kaapi, I will only first look at your dress. Because you really come out with such, bright colors that, the first thing that attracts me with this is, and then I start listening to the conversation actually. So it's really, very, very heartwarming and really close to heart, the way you're conducting it and the way, all the stalwarts, the eminent yoga experts so far, we've really gained so much. And thank you for having me also in this platform.
Oh, I should thank you for accepting our invitation and joining with us. That's so nice of you. I really don't have good collections, nor I just go randomly pick up some which is kept in my cupboard by my beloved father. So I just pick it up, put it, and come here. That's it. That shows today, that's the difference it's making. All the days we were having men yoga stalwarts, the yogis who are coming, and today when we have a yogini, look at her perspective. So that is what the power of, I think, Nari Shakti. So that is
we look into all the dimensions. It's not just one part, because we have so many roles to play. So it is not one role. So we look at everything, not just the conversation, the content of the conversation, what you're wearing, what the speaker is wearing, everything.
Wow, thank you so much. In fact, that's the thing that we have so many great women dedicated in the field of yoga. In fact, today's yoga field, more women are coming out and they are doing wonders. But because of the multiple roles that they need to play, especially now you see the scenario of lockdown, children are at home, the whole family is at home. Therefore, many women, they are not able to spend time other than these things to come to such discussions or anything. So that's a challenge I was having. I equally wanted to have, in fact, when I started thinking, there are so many wonderful women dedicated in the field of yoga. So I thought we should alternate a men and a woman equally, samatvam yoga uchate need to establish, I was thinking, but it was really challenging. Though they wish to come, many have a tough time now. So in spite of such tough time, I'm so glad that you have taken time to be with us. And for the benefit of our viewers today, Dr. Meena Ramanathan is a wonderful academician in the field of yoga. we have been seeing various kinds of people, yoga teachers, yoga acharyas, who had different backgrounds, from where somebody is a parampara, like their lineage father, for example, Dr. Ananda, who is the friend, philosopher and guide for Dr. Meena Ramanathan. He comes from a lineage of yoga masters, and so it was natural for him to imbibe these. Whereas for a common woman like her to take interest in this along with other family duties, children, everything. So that is something wonderful journey that she had. I think there is no course left unattended by Dr. Meena Ramanathan. It could be right from maybe as a teachers training program. I would say always a YAC, YTC, ABC, MSc, BSc. To PhD. PhD is like always I say, it's a kind of a permanent head damage. So to that extent, she had gone to that extent of right from starting the yoga courses right from scratch. Along with it, I think she had attended wonderful lot number of courses in English and mathematics, and I think there is no subject untouched by Dr. Meena Ramanathan. So
with due respects to my guru, Dr. Ananda Balyogi sir, because whatever I am today, the platform I stand in, it is all that I owe it to him, and thanks to him, because the way my original subject where I started was chemistry. So I'm a PG in chemistry, and then I did my PG in English, and then I came into like just for practicing yoga. When my son finished his 10th, there was a big vacuum.
It looks like your qualification looks like the famous notorious lecture of one of the notorious spiritual person who says the physics of a chemistry and the biology of mathematics.
Nowhere that.
Just for fun, I said,
I know.
English and chemistry coming together with yoga.
Why I chose English? Because there was no practical in that, so I didn't have to attend any college because I was pregnant at that time. So I did my MA in English literature those 1 or 2 years when my baby was so small. And I didn't have to go to the college and do anything. I could do it from correspondence. So just to fill up that vacuum, that empty space, I kept doing something. So, and then like when my son went to 10th standard, there was a huge vacuum. It is not just in my life that I'm telling you, it is there in every woman's life. Initial life is like when the baby is small, you get married, you have a family, so you are the nucleus of the family, everything is revolving around you. And then what happens, when the children grow up, and then your husband is busy with his job, so there's a huge, like, you don't know what to do. One fine morning you get up and say like, hey, what is happening to my life? Where am I? Like what I was and what am I now? Suddenly, you go into this phase of depression. And that was when, we went to a program, and Ammaji was there, the yoga program, the annual day program of Yoganjali Natyalayam. And she said like, why don't you start doing yoga? Wow. So I would say that was my turning point. And then I started learning yoga just as everybody does. And then, like there was a competition which was supposed to happen, Bangalore Himalayan yoga competition. And I had just like 6 months after joining, and I didn't want to go for the competition. And there was a theory session which was being conducted by Dr. Ananda, and I had to like gate crash, fight with him to be in that session, because he said only those who are attending the competition can attend the session, theory session. I said, no, I am going to be there. And that was the the whole change in the U-turn that my life took. So that one theory session of Dr. Ananda made me realize that yoga is not just the practices that we were doing in the classes, asanas and pranayama. It is not just that. There's something more beyond all these practices. And then, I joined college again, community college, started doing all the courses, and all that, blah, blah, blah. So it's now, that's the kind of journey that I've had. But I'm truly happy because this is one medium where you can reach out to people. So that has been sort of my prayer, I would say, since my college days, where you could reach out to people, interact with people, be of use to somebody, not just
actually, that's where I see a difference in you. Whereas when I see with many women, when they do yoga courses, they come, do courses, get trained, but afterwards putting it into a practice or as a career, somewhere they get stuck. Though the challenges are there, the same challenges were with you also, but you could, make the challenges as opportunities and, balance with both the ends, and then you were able to take ahead to that extent that, it's not so easy. All this accomplishment, what you have accomplished today. Today, you are an associate professor in an esteemed university in the center there, and also you are a member of board of studies in various universities, not only in the university where you teach, but you go visit to, set the syllabus, and sometimes as a visiting faculty, you are invited in various prestigious international and national conferences to present papers. As a researcher, you have been continuously doing research, and along with the team, along with Dr. Ananda and others, you have been publishing more than 3 dozens of papers that you have published. You have co-authored number of books, and also you are a certified yoga therapist from the International Association of Yoga Therapists, and which is not so easy. The standard, the international standard set by them, it's not so easy for any common, normal yoga teacher therapist to achieve that. So all these, you have over the years of time without stopping, where you have today, people feel I have done a course, 1 month course, certified, so that's enough. Put their collars up and they start, doing courses and teaching around, and that such is the thing they start. Whereas, you have been keeping this efforts non-stop until now, doing one after other. So that is something very amazing with you when I see. So one thing what I want to ask you is, so you when I said in the beginning also that number of people, women who are taking up interest in yoga is definitely more. Even in classes, the students, when they come, they are the more they do. Do you think that a lady yoga teacher like you, bring a different dimension to a class when you teach than all of us who are there? So if so, in what capacities that you think that a lady yoga teacher can bring out a difference there?
So before that, let me just tell you that, because now you were telling, I was able to balance both my, the professional life and the family life. I have to thank my husband. I think I have been very fortunate with a very, very supportive person at home, because other than that support, I will never be able to move out into the world and take it up as a profession. And of course, in the professional life, without the support of Dr. Ananda, I would never be able to, put my foot into this kind of a life. So one is like the family backing that I have, my son, my daughter-in-law, my grandson, all of them are so very...
What do you say? You have a daughter-in-law and a grandson and all?
Yes, I have a 6-year-old grandson.
Don't put us into surprise like this.
No,
I was thinking that your son must be in class 10 still. You were telling in 10th standard.
No, that was when I started yoga.
Okay.
He was like that time. So without that family support, any woman for that matter, she needs that family to understand and give her that freedom and independence, so that she can go out into the world and she can explore her own interests also. So that way, I think I have been very fortunate, and thanks to the divine that I got both my husband and Ananda sir in both sides, where they could support me and back me up. And without them, definitely both ways, I would never be any place at all. And thinking at the next question that you asked me, how different is a class with a woman and somebody else teaching? Say for a woman, it has always been, she thinks for the other person.
Wow.
Every time, even at home, she has to care for the baby. She has to care for her parents-in-law or the parents or the husband. So she is always thinking of the other persons to take care of. So it is that same kind of setup when she is taking a class. It's like kind of, the care automatically sets in. Even before you start bonding with the class, there is this, you should not harm them. So can you do something else for them? And we start associating. Say, for example, when I'm doing a senior citizen class, I would always associate with my parents-in-law or my parents.
Wow.
So it's kind of, something like that. Children means like my son or my daughter-in-law or, somebody who's close to me. So when we are doing a class with them, with a group or with an individual, it is like we are easy to associate with them in some way, relate with them in some way, and which I think, the warmth is there. So there is a natural caring attitude which comes out, maybe that is like different in a woman approaching a class than somebody else, is what I feel. That is what, like, that's my experience.
Very nice. In fact, I think you already answered the next question I was about to ask in due course of what you were sharing, because I was trying to say that very often ladies who come to the class would, usually in Indian scenario, we have the Western world also today and other countries. Yoga is very popular, as we have been hearing through many international teachers who have been sharing all through these days, that everywhere yoga is welcomed very well, and people come, especially women are the number of students I see who are going there also, but they don't mind the teacher to be male or something. Whereas in Indian context, especially in South India, we see very often, the ladies prefer a lady to be their teacher often, probably because of the comfort that they may feel and the concerns they could be empathized with. So they always feel the women to be their teacher. So given a choice, I was trying to ask, why would you say a man should choose a lady as a teacher? So I think already when you said that, women thinks more for them, the concern, she plans very well. So do you think any other reasons could be there for that, adding to this?
I don't know. My personal experience has been like, fingers crossed that so far I have never had that kind of a resistance at all. And there has never been, in fact, I have never had a women class separately. It's always been either a mixed group, corporates or children or, like elderly people. So it's always been a mixed group where men and women practice together. Or in college, like where boys and girls do it together, in community college, in the university, Pondicherry University. It's always been kind of a mixed group that I have not had any resistance because I am a woman teacher. Even with men, like male corporate groups, it has never been a problem for me because, like, I don't know, maybe studying in a co-ed school has always made me so outgoing and an extrovertial character that I'm very free with everybody. That there's no kind of an inhibition. So I can maybe get along with people in an easy way that I don't know. That is, I'm just speaking from my side. Maybe generally I don't know whether, maybe before, like you go and correct them, if it is a men class, where the corporates where we are doing, if it is a whole male population, maybe I would have had to take their permission. Can I correct you?
Correct.
Is it okay? Do you mind if I correct? So because they are going to be in groups, that's what I have never had any resistance of that sort at all so far.
No, it was not from your side. I was trying to ask from their side, why should the man choose to learn from a woman? So it's the other way. So why would, for example, if I have to choose Dr. Meena as my teacher in yoga especially, so what is that important thing that you say that what makes her class so distinguished from the other people? Now, given a class that I have a Dr. Ananda's class which is there and Dr. Meena's class which is there. So why should I choose your class? What is that which is making that to be so special in your class?
The caring, I would say, and the way I handle the class. I will never compare myself with Dr. Ananda.
No, I just
never ever.
No, that is a different case. I'm not bringing the Guru or Sishya here. Just the gender I was just trying to bring it.
That depends entirely on the man's perspective. Entirely on the man's. A few of them, maybe they would have had inhibitions having a female teacher. But that's what I said. Like, I have never had that inhibition. So in a class, there has never been an objection or I don't know. I have never experienced that. So I cannot speak from that angle. I don't want to say anything wrong.
That's okay.
Let me be non-committal.
Another thing what I've seen is a yoga teacher, invariably also becomes a counselor. So, especially you have been working with children with special needs, the Divyanga, and also the geriatric community. In fact, your research PhD itself has been on working with geriatric populations. So, do you think the caregivers, are also directly in need of yoga? Those who are the caregivers. What is your say on that?
Very, very true. Very true that more than, the special children, It is actually the caregivers who are, 24/7. They have to be with these children. See, for us, we go and see them maybe 1 hour, 2 hours, and then we come back. Whereas for them, it is like 24/7. They have to, take care of them, which is like they are under a lot of pressure from different dimensions. One is at home, and like parents in law or the parents also never understand. They always blame the father and the mother for having a child like this. And I don't know, they keep all these superstitious beliefs are still down in the society, especially down south. If you go into the rural areas and all, it is very much prevalent now. So it is like we have to counsel them and tell them it is not the parents fault at all, because they keep cursing the parents.
Very true.
On top of having such a child to take care of, this is another pressure which they have to go day in day out, which is really like a taxing thing. So they are the persons who really need to do it, like do yoga, because the relaxation is very much essential for them. And that is why like wherever, especially Kaivalya Dhamma, we had this program called Yoga Mela. We started like as a step-by-step process in Kaivalya Dhamma. Again, fortunate that thanks to Subodhji and thanks to Dr. Prasida Menon, where they invited through Saiter, of course. And we had this 3 step-by-step process. One is the Yoga Mela, where we brought all the children, their teachers, their parents, and their siblings. All of them were assembled together in one hall, and we did the practices together with everybody, which was kind of a real mela. Mela means a festival, right? So it was a real festival because we never knew what to expect there. But it was kind of a very big success, because one is the teachers and the parents get to see how well the children are doing, and also what their limitations are. So where is it that they need support, and what is it that they enjoy more? What is it that is difficult for them? So if they are doing along together, there's one more thing. The child is so interested. Any special child for that matter, they want to come out, and they are attention seeking, and they want people to notice them.
Very true.
They very much want that. That is something that I have experienced. You put them on stage, doing a competition or giving a performance. Initially there is a little resistance, but then once they go up on stage, you can never bring them out, because the moment they see people encouraging them, clapping for them, it is like their joy, it is like leaps and bounds, and they start performing everything that they know. So generally, like special children, or for that matter every human being, is attention seeking, right? Who doesn't want appreciation? Who doesn't want attention?
Very
Right.
true. In the beginning, when you appreciated about my dress or the way I did, you should see the aura around me.
Yeah, I can see that now also. So it's kind of the way the children responded to this, because the teacher were there, the parents were there, the siblings especially were there, the siblings who were normal.
Correct.
So when all of them did it together, and then like what we told them, even at home, please do the practices together. And then when we got the feedback, the parents said it is like a beautiful bonding is now built up between the siblings and between the parent and the child now. So there are so many other things that are happening, positive benefits that we say normally with yoga.
Right.
So that was part one. And then the second one was training the teachers. So TOT program, training of the teachers who were teaching the special children, special educators. So we had a yoga protocol made, and then we taught them the second intensive training we
But
gave.
that's what I was about to ask you. Is it the same like what yoga generally, even otherwise, what people would do? Or is it something specially you module it, you modify some of the techniques, because you will have a lot of challenges in making them understand and do it for the special children?
Yes, of course. It is really, really challenging because, like they will be in a group. When you're doing, you're not one-on-one session is not possible. because I'm just sharing my experience. A group therapy, a group session with the special children is always a therapy by itself.
Wow.
I have also noticed that with the senior citizen. People who can vibe with them, people who are of the same wavelength, when you're doing it together, it's like, oh yeah, I'm doing it with my own kind. So it is like, oh, he's doing, there's a healthy competition.
Yes.
He can touch the toe. Okay, fine. I have to strive. I have to try to get that done. So it is kind of, there is a positive peer pressure among the children. So it is in a group, and there will be a mixed group. There will be like the children with just mental challenge, or there will be physical challenge children also. Like, for example, the children with cerebral palsy, they will have one or two limbs affected. It is kind of like a difficult situation where they will be utilizing only the legs and not the hands, or otherwise. So and the Down syndrome children, they are extremely different. So it is kind of a group that we have. It's a mixed group. And ADHD children, the attention deficit children, hyperactive children, or learning disability, dyslexia, children with like they cannot hear, vision impaired, all of them will be in one class.
Wow.
So what can you give them is something that can suit everybody. Like, for example, like as a woman, I can say, when you're cooking, like you cannot make one dish for everybody. So the common things is what you would prefer to make. Say, for example, potato is like everybody likes it. So it is something like, like you choose the techniques so that everybody can be comfortable in that technique, and it is not going to harm them. And slowly, step by step, you take it forward. And like with the Down's child, he's very, very flexible. Whereas with the CP child, they are very stiff. Naturally, the muscle tone is very tight for a child with cerebral palsy. And you have to be thinking about the epileptic seizures. Suddenly, they end up having a seizure. So you have to think about that also. So you have to be doubly careful. But if you start giving that attention to them, they are very conscious, and they stop responding the way, it's not natural for them. So you have to be very diplomatic while handling them, so that you don't hurt them, but you don't harm them also. So it's kind of like,
how do they receive it when you are giving them yoga? How do they receive it? How do they cooperate? And how do you seek their, though you said they are attention seeking, all those are there. So overall, to retain them for at least an hour, the class would go. So to keep them engaged, it's not an easy thing.
Yeah, initially it used to be very difficult. I used to feel like crying sometimes because I didn't know what to do. I would feel so helpless. How do I, like get to all of them? But then once you start understanding them, once, you look into their eye and you understand them, because, like they will be smiling, it will be so disfigured. I'm sorry to use such derogatory terms. The smile will not look like a smile, but if you look into their eye, you can reach their soul.
Wow.
So you just take one step forward and they come over to you. So all you need to do is like give them that love, and then they are completely with you. So whatever you say is the, like we say, the sentence for them. Veda Vak in Tamil we say. Yeah. So they just follow it blindfolded. You tell them jump, they will jump. You tell them sit down, they will sit down. So it is like very easy afterwards. But initially, till you come into that kind of an agreement with them, till you have that, it is a little difficult. But I would just like to share one video to show a child.
wonderful. Actually, in fact, to see the other lady who was there nearby, who is also coming and, looking into that, and that's a very touching.
She is also actually a special woman, special
Right.
child with Down syndrome. So you saw the kid who is like a cerebral palsy child. Both her lower limbs are not acting at all. So she'll have to like move, on her buttocks. Actually, she'll move like that or crawl around. But you could just see the joy that she was expressing when we said we are going to have a yoga session now. And the group, she'll go call everybody, she'll bring everybody into
Wow.
that hall, she'll go, come, 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 well, let's get started, let's get started. And she's so limited because she can only sit and do. But whatever she could do, she would, like be happy. And, that is something that you find very special with these children. The level of self-acceptance. They accept their handicap as their strength. So it is the disability doesn't matter at all to them. In fact, that is not a limitation to them, that is their strength. And they don't look at others and feel bad. Oh, she is doing something in a standing posture and I'm not able to do. That is the normal human tendency.
Very true.
Whereas, with the special children, these population, they are all, like I would say, way beyond in evolution. Like Garuda Purana says, we have to undergo 84 lakhs births. And, like the closer you are to that Paramatma, after having evolved so much, the closer you are, you become very high level thinking. So I would say these are very evolved souls, because what these so-called normal human beings feel, the shatripu, the jealousy, like when other child is performing, they are never jealous that I am not able to perform, that the other child is performing. It is never that, because they all sit in a group and they clap for the other child, which is kind of like very rare among a normal population. Yeah. In a normal school, you go and take, it is like a different experience. So that is something, like highly evolved people, and they accept that whatever their limitation is, and they try to convert that and make it a strength for them. So the self-acceptance is leading to their self-empowerment.
Wow.
Because when we say yoga is supposed to empower that individual so that they can, the ability, whatever potential they have, they can help, manifest that to the best of their ability. Say, for example, with the special children, what the target that, when I started teaching for them, the target that I had was like so that they can become independent, at least to take care of themselves in their daily routine work. Say, for example, simple like buttoning a shirt, combing their hair, and, like we have done a study in our hospital with the dental, it was an MDS project where we found brushing skills. Okay. Improving the brushing skills in children with autism spectrum disorder, because they often have this problems in the mouth, caries and all those dental problems, because they are not brushing the teeth properly. And the parents, of course, they help them, but there are times when the parents have to look after their other things. So that is why I said you have to make them independent. And we found that the brushing skills are improving tremendously with yoga as an adjuvant therapy. Because the same was showed as a audio visual pedagogy was given. That was one group. And the other group did yoga therapy along with the audio visual pedagogy. And they found that the dental problems was completely not there in the children with yoga therapy. It was completely like a very good dental hygiene was maintained in those children. So they could understand and take up to the brushing skill, which had improved. So things like, simple skills like that, wearing their pajamas, tying the knots, these are motor skills which they cannot do. Like, for example, the coffee. or the hot any drink, if they have to, get it cold. So what we do is like we take it into two different vessels and do it. And for that, the eye hand coordination is very important. So the motor and sensory coordination, it is a little low in these special children. So if we do it, for us, it will go into the other vessel. But for them, majority will fall outside, not into the vessel. But after yoga now, it is like their eye hand coordination has improved tremendously.
Wow.
There are so many other factors which, by experience, I can anecdotally keep on going. But how do you bring it into the society? How do you make science accept? That is the big $1,000,000 question.
I was about to ask the next thing to ask you.
I think I'm reading your mind. Yeah, please go
ahead.
What
happens between yoga practitioners.
So
that's what it's no. Actually, one thing I wanted to know is what is the outcome when you teach yoga to them, to special children. What is the change which is aimed at? What is the outcome that you very well said? To make them independent to do certain basic things on their own. If that much they can do, that's a great thing. And one more thing, it was very revealing when you were saying that they don't have the Arishat Ribus, the basic, human or even the animal instincts, what we say, which is very much predominant in all of us. All struggle all through the life is all about how to, get rid of that, and they come back again and again. So that is where I think even the higher evolved souls, we hear in the Puranas, people like Jata Parata, they were just Jata, like not having any physical movement activity, they were like that. We say Nammalvar when he was born, one of the saints from south, Nammalvar, when he was born only, no locomotion, nothing, no speech, nothing, but he was just alive, sitting for years together under a tree. But inside there was a spiritual, evolution. So this is something wonderful, a spiritual yogic perspective to look at them, for even parents to, many parents sometimes when they get a child like this, the thing is, what sin did I do? Why did I get a child like this? So this is a wonderful yogic perspective, which is to understand that they are God's gift. It is not a ban, but it's a boon that you have got. Is a wonderful insight which you brought wonderfully. And how did you get your interest in this? First of all, I wanted to know. There are many who would be interested in generally teaching for normal people, doing more of teaching for healthy people, normal people, or even as yoga therapy for the rest of the people. Your interest has been on two categories. One is the children with special needs and senior citizens. So how did you get interest in these two categories naturally? How was your interest in this?
Yeah, again, thanks to Dr. Ananda, because there is one school, Sadeh School, who had, wanted yoga classes. So the organization Sir runs, Yoganjali Natyalayam, they approached them for a yoga teacher if they could come. But the only thing was like, it should be on a voluntary basis because, paying a teacher is not possible for them. So they had requested that. And, like in college down in the NSS, as part of a college NSS, I have always worked with the blind children and the deaf and dumb children. So it has kind of been there, like I would always do that. So I had told Ananda sir that if there is an opportunity, I would be more than happy to do it, do any session with them. And then sir said, like, this is something that has come up. Would you like to take it up? And it is like, that's why, like I keep telling sir, you always throw me into the ocean, and then it is like I have to find my way out. He says, like, you can swim your way out.
That's what the guru does with all of us, in our own ways.
Otherwise we won't learn. So the moment I went into this class, because I have not dealt with these children, especially with yoga. I have done scribing work with the blind. That was a different experience. Working with the blind children, you had to write out notes for them. Whatever they say, you have to write it out. So it was kind of different. But teaching a yoga, taking a yoga session for such a varied group was a different kind of an experience. So, but slowly, it was built up day by day, day by day, day by day. And let me just tell you one thing. In the initial sessions, the parents used to come and cry and tell us that, at home, when these children go home, if the guest comes, these children will be put into a room, locked inside a room. Because if they throw a tantrum, in front of the children, they will feel embarrassed. But with the yoga practices over these last few years, the children are now entertaining the guests. They take water for them, they take coffee for them, they sit with them,
They
they show.
sometimes can even show the yoga what you have
Yeah,
taught. Honestly.
and they can sing for them, whatever little talent, they keep them entertained. And it's like so beautiful to listen to the parent when they say, and the parents are so proud now to say that, before they used to feel ashamed to say, this is my child, to introduce this child to anybody. But now they are as proud as they are, introducing a normal child. They are, it's like the acceptance level in the parent is also now, like they are able to accept that. So that is something, like over the past 15 years of my experience with them, a child who was 4, who started yoga with me, now is 19.
Wow.
So it's like, I won't say she has grown with me, I have grown with them. So I have sort of understood myself better than understanding them. It's such pure, like there is no mask, there is no pretense. You can just be you. You don't have to think like, can you say this? Can you say that? Will it be mistaken? Absolutely nothing. You can just be you, and they accept you as you. And all they need is like you to accept them as them. So once this bonding is built, it is for life.
Excellent.
So now it is like, you give me a group of any group with special children, I can handle them. So it's like I can, I'm confident enough that any group you give me, I'm happy, more than happy to involve them or be with them, or like do something with them. And like anything that is joyful is something that is always close to us. Yeah, when we are children, why do we always remember the school days, college days? Because it was such fun. The fun is what we remember, not the teacher gave me punishment. We don't remember all that. So similarly, when I'm doing a class with these children, or with the special, with the senior citizen, uh, it's always a fun filled class, so that they enjoy, and whatever we enjoy, whatever we are happy about is close to heart, and they feel motivated to come back and do the practices. Like there is no correction given. I'm very strict with that the teachers who are there to assist me, I will tell them, please don't go and pull the child's hand, saying that you're correcting. Say for example, in Trikonasana, what do we say? The hand should be like this, straight, correct, shoulder level. But a child, if we cannot do that, it will be like this. It's okay. Slowly they look at the others and they correct, and they can bring it to that level. Because once you start correcting them, even in a normal class, even for the senior citizen, when you start correcting them, when you start pointing out their mistakes, they become so conscious that, like the next time they start looking around and, can I do, will I be noticed, kind of. So let them enjoy, let them do it. But finally, what I see is that
Today most teachers think that is an essential duty of a teacher, to go and touch them, correct them. That is what the so-called yoga teachers, the youngsters, especially when they come, they look at that part of it too much as an important salient point that the teacher should do as a duty.
In a therapy session, of course, when we are doing it with the patients, if they are totally wrong, you tell them that, please, this is one, you can look at me and can you follow me, at least again diplomatically.
Correct.
Without going and pulling their hand on saying that it is supposed, the fingers are supposed to be like this, it has to be intercrossed like this, it cannot be this. So slowly a little bit of correction could be given, but like again, that has to be done diplomatically. But I don't know, I have never gone and corrected a child. I would be afraid, in my apprehension that they don't fall down, I'll go stand near them, so that if they fall down, I have to support them. That's the only thing I do. But I don't really correct their postures. But like, if we have time, do we have time?
Yeah, please.
If I can share something, a PowerPoint where, like I would like to. If you can see, this is a competition going on, and that is a special child. Can you believe that?
Wow.
See, this is a child which I have a story with him. He is doing Vrikshasana. He is an autistic child with ADHD, hyperactive. I'll tell you what happened with him. See, so can you just see Uttita Padmasana? This is like something where I have to help. Can you see these are children with special needs?
Wow.
The way they can do, just see how disciplined they are in a class. This was not just for photo. This is our usual class. And this is, like what you're seeing the screen now is like a group of special children with normal people. What they are performing, you can see, is there any difference between that? This is again a group of special children. This is a deaf and dumb school where they are doing the pranava pranayama. And they were able to give that sound.
Wow.
See, look at that. They just need the love. They just need. Can you see? Can you believe this?
Wow.
This is a demonstration that is going on stage. All of them are special children. Can you see somebody coming and helping them? And
Wonderful.
all of them, there is no teacher nearby. They are. Can you see anybody out of the line? See, all the teachers are in the back. So this is what they need, the love. Don't we owe it to them? The child I showed that with the Vrikshasana,
Yeah.
he is completely autistic, ADHD, attention deficit, and hyperactive. He'll not stay in one place for 2 minutes. And when the competition comes up, which is again a positive peer pressure, that it motivates them to perform. And this is a stage he's standing in Vrikshasana. See, the posture may not be perfect. I'm not bothered about that. And we don't judge a student with the posture perfection, with a special child, because the ability to stand there, balancing in one leg is the happiest moment for me. If you had seen when he was receiving the certificate, I was happier than him. Because, like, I just had to tell him because he was not able to do it in class. And I said, like, we will choose some other asana for you. No need this. But he was sort of adamant. When he went on stage, he wanted to do that. So I had to, like, generally when we were talking, I showed him the tree from the class window. I said, that is what you are doing now. Can you see that tree moving? So the tree is just standing there. So you are becoming a tree there in that posture. So that is all. And when he came off the stage, I had to sort of, pull him out of the stage. He was there just standing on that one leg for, like after we said relax also, he was not relaxing. He was so happy. And I was happy. So he said, like, after he came off, I said, how could you do it on stage? He said, you told me like I had to be a tree. So I was a tree there. So I just stood like a tree and it was easy. That's all. So when you're teaching, you just have to give them that relativity. That is it.
Exactly.
So modify it and make it easier for them, make it enjoyable, make it joyful.
Very good. I think you have given a teaching methodology, a pedagogy also for teachers who will be watching this, how they should, bring this as a teacher to do it. Wonderful. In fact, when you are telling about the fun that we would have in school, college, the school days, but today after this COVID-19 started, children are at home and school. Earlier they were saying you should not take the phone to the mobile to the school. Now school has come into the mobile.
Of course.
They are watching it for it's fortunate or unfortunate. We are also doing it all online now to do it. So even for normal children, it has become so difficult, the situation at home, everybody having gadgets. And earlier we used to say the screen time should be less and they should do it. But now it is increasing more and more. So is there any remedy in yoga that children can do to get rid of the otherwise ill effects of using the gadgets more, especially this time their classes are happening online, they're playing online, everything is happening. So is there any yoga that can offer that some solution to children who are normal, say even not the special children, but even for normal kids that yoga can offer?
At Yoganjali Natyalayam, when the children class is going on, there will be a group of around 500 children practicing. So it is kind of like, again, the fun that is being taken, and all of them love to do yoga. So if you give them, like with a child, what we need to do is like, for example, when we are moving around in Chatushpada, we'll just move around, crawl around with different animal sounds. With a special child, with a senior citizen, with a normal child. That is like, can we all be cats now in a four-footed posture? Can we all be cats and they'll all be like meow, meow, going around? So it is kind of like all their, like repressed and regressed emotions. It is kind of a let out for them. So like shake and throw and have fun, make a lot of noise, be a dog, bow like a dog, and a lot of things that we do, and the stretches that we give, all of that, like mentally, they feel so relaxed. And with a child, you can never tell them to sit and meditate. To sit, make them sit quiet. It is like, again, it is kind of a active meditation. So what I would do with a special child, especially, is when we say like we are doing a meditative class, I would put a picture of a cone ice cream in front of them, or a 5-star chocolate in front of them. I would tell them, keep looking at that for a few minutes. So this is a 5-star, and then now Padmasana, they are very comfortable, absolutely comfortable. They can sit at least for 10 minutes, even for more than that. But I would tell them to relax. So they would come in Padmasana, have the Dhyana Mudra, and keep looking at that. So their focus is on that. And then slowly I would say, now close your eyes, and whatever you are looking at, just focus on that. The ice cream, beautiful ice cream, the cone ice cream, white in color. So it is like, and then I would just stop saying anything, and then they would sit. So it is kind of like that, that they can sit quiet. For the normal children also. Something
so after the meditation, will they not come and ask you the cone ice cream or the 5-star chocolate?
Of course, I have to do it for them. I would always have the 5-star chocolate with me. That is kind of the gift they get. It's always there. Cone ice cream illa. Occasionally, of course, cup ice cream. But this is like a everyday affair.
Very nice.
Like how, like in a horse's stable, they would give the cubes of sugar to a horse to train them. So the 5-star was kind of my training tool with the special child. But they care a damn whether they get a 5-star or not. That was just for my satisfaction. I used to share it with them.
Correct.
So
I think
COVID times, one is the immunity factor, which we have to focus upon with the child. So one is when they are doing yoga, with all these techniques, we are definitely enhancing their the respiratory apparatus, so that the immune factor is naturally enhanced. So we also do all these breathing techniques where we are doing long exhalations, like the pranava or any pranayama where the nada is used. So long exhalations help us to enhance that kind of state of state of mind, relaxation response and all that, which also enhances the immune response in the individual. So because you were mentioning the COVID, I thought like I would just say that.
For the eyes, like because they're straining too much on looking into the screens and doing a lot. So for children, especially even elders also nowadays, for example, even I as a yoga teacher, I'm spending a lot of time on screen nowadays, but more than what otherwise I would be doing. I'm not able to see people coming to center and teaching them, so I'm teaching more of online. So I think Trataka is something that we can do, and
Trataka could be done, but for a child, special child, you cannot do this.
Okay.
So what I would do in a class is the Angula Drishti. Say for example, they are holding Trikonasana. I would say, please look at your middle finger and focus on the middle finger. So that is the kind of Trataka for them. So you cannot tell them like, Atho Mukha Trataka, Urdhva Mukha Trataka, and then tell them.
Even normal children that they can do, right?
They can do. Yes, normal child can do. Yeah, certainly they can do. And, all the eye exercises, the palming, but, active kind of focus is with the Angula Drishti. Say when we are doing this, the Utkatasana, the half chair posture, the hand stretched out and you will be sitting down like a chair. So there, the focus is on the hand again. So the focus is kind of built with that also. Along with the asanas, along with the practices, the focus is also built.
Very true. Now, the other dimension that you have is of senior citizens, where I think the silver yoga, which you've been teaching, and you have done a lot of work on that, research on that. So how do you see that the receptivity is there among senior citizens? Do they come? Do they take yoga very seriously? Do they practice? And do they have any better results of doing it?
Results, of course, yes, tremendous benefit. But then it is like, like the senior citizen, they go back to their childhood once they start aging.
Wow.
It's like a second childhood for them. True. So how do you handle a child is how you handle a senior citizen.
So you have already experience of handling the children, so you can just
something similar. It's something similar because they are very adamant if they want to be. They do not want to, especially where I did my PhD in the hospice, they were all in bed and they did not want to come out of the bed. Because one is like their mind, totally like, like I'm aged. What is it there in life for me? So far, like they would have been as a grihastha very active. Now moving into the vanaprastha stage, they are retired, but then they don't have much to do. And their mind says like, I'm not being respected as much as I used to be. So it is kind of their own self-imagination that they go into this depression. They do not, the confidence is lost. Their self-esteem is lost. But once they start doing this yoga with the same group, similar group, at least there were a lot of benefit. One is like they were able to become independent. They did not have to have another person to drop them in the class. They started driving their own scooters and coming to the class, the silver citizen classes. In the hospice, what was like we had to go and pull them out of the bed and bring. Why should I do? But now once they put the foot down and they started doing this yoga sessions, now they are saying, it's like I have got a new leash of life, a new meaning to life, a new purpose to life. So now they are like helping around the hospice, helping the other who are disabled and in bed, taking care of the other people. So it is like what little they can do. That is something, giving a purpose, giving hope, giving their confidence back, giving their esteem back. That is something which is very, very positive when a senior citizen class. Other than that, this is the qualitative benefits I'm listing.
Yeah.
The other, the normal benefits, like the BP comes down, BP is normal, the diabetes, the sugar levels are sort of normalized, and they are functioning better. The arthritis, the ability to move their joints is better. The turnability, the twisting ability, moving ability, the range of movement, all that is enhanced. Say, for example, there was one senior citizen auntie who used to dress so well. So she had to depend on somebody for, putting a pin on her sari. Because her hands were totally stiff with the arthritis. And with the yoga sessions, maybe 3 or 4 months later, she said like, can you notice something different? I said like, no auntie, you are looking as usual, as beautiful as usual. She said like, today I pinned my sari myself. Because the finer skills, I could do it myself. So these are little things. And there was a senior citizen who was very happy, said that I could sit down and do my prayer. There was one particular Musalman Dada who wanted to sit in, but that was the aim with which he came to yoga. I want to sit down in Vajrasana and do my prayers. So once that is God, they said like they are so happy. What, you are giving back the hope, the happiness back into their life. What more can you ask for?
Very,
So,
very nice. And last one thing which I want to know is, you're having worked with the senior citizens, the geriatric community. What is your message to the younger practitioners about what to expect in terms of inevitable age-related changes that will come and how to accept them with humility?
You mean for the young people?
Yeah, people as we age, there are going to be inevitable changes, age-related changes which are going to come.
Yeah.
So how do we accept that and take ahead? So what is your advice to the other
We always say, that prevention is better than cure. So starting yoga at a young age, at least now we are trying to promote that awareness. With all this, COVID situation, that is one positive thing that has happened. With all these online sessions, everybody is coming online and there is like this session, that session going on. If like according to your preference, you can start with a minimal practice and then keep doing that. Need not be you have to stand up on your head. Shirsasana, Karnika, that is not the ultimate aim, right? Just to keep fit and keep the mobility on, as well as the positive mental, psychological benefits that you get with these practices is being promoted. So as a part of prevention angle, if they can start early, when they are young and when they are able to do these practices, there is no age. That is something that I would always tell. We have had, in senior citizen classes, like people 65, 70 years old just beginning to do the practices. So the age limit doesn't matter at all. It is your will, the intent to, start something. So the intent to learn. But for the younger generation, if they start early, one is they can prevent, they can avoid, or they can delay the onset of all these problems.
Exactly.
That is something that we see in our hospital also. Delaying is very, very true. You start early. Say, for example, you have a family history where diabetes is like around 30 years old, you have diabetics in their house. But now with yoga, like we say, the gene expression can be changed because your will is changing. What you're looking at, your outlook, your attitude, the bhavana is changed. So you don't focus on diabetes. You focus on being healthy. You focus on being happy. So the quality is what you're focusing on and not on the disease. So that is the salutogenic approach to health. So you're focusing on wellness rather than the focusing on the disease or the cause of the disease. So you are focusing on the cause that promotes health. So the young people now, I feel that with all these online sessions, that is a positive thing that is happening.
Very true. Very true. Thank you so much. And when I was talking to you, one more thing that came to my mind is now those who are watching, in fact, are lot many women yoga practitioners and who are aspiring to become yoga teachers, and lot many are there already who are doing. In fact, on March 1st of this year, March 8th was the International Women's Day, and March 1st we had a national yoga conference exclusively for women, Mahila Yoga Mela, and I had an article for you also. I wanted you to come also, but we couldn't this time.
You are really doing excellent work, Bhayaji.
Thank you with all your blessings.
Involving everybody is something which is not possible.
Where in that conference we had around 300 women yoga teachers, or some of them are still students. They were doing their masters and PhD. They are yet to become, but 300 who are full-time associated with yoga, only from Bangalore. That it was only from though the speakers and presenters from far and wide, but almost like at least 70, the people come from Hyderabad, from Chennai. We had 2-3 foreign delegates also, but majority were even from one place, from Bangalore. Then imagine this things like everywhere. In Pondicherry, you are the first woman to do a PhD in yoga, but today many are aspiring to do it. So coming up, and everywhere, all over the country, we see. So as a academician, woman who had established yourself, you have your own mark which you has made in the yoga field. So what is that which you tell as your message to these young aspiring women yoga teachers?
Please continue doing whatever you're doing with your full dedication and sincerity. And we always keep telling Bhagavad Gita's message, do your best and leave the rest. So do not expect anything in return. Do not think that I must start earning and learn a course. I must start earning. You're not doing the course, you're not learning something for earning. If your focus is on earning, it will be limited with only the earning.
Very true.
So what we need to focus on is that dedicated, sincere approach to, be of service. The rest will automatically follow. Your earning also will come. You start doing practice for one benefit, but all the others also fall into place.
True.
So similarly, you start just doing the practices as something, experiencing the practices just as an experience, and start sharing that experience with everybody. And that is what you're teaching. Be empathetic and reach out to people and try to help people. So the rest will automatically follow. And try to balance both the professional life as well as the, do not give up your family to run a profession. Because end of the day, when you sit back and think, you will never have the satisfaction. You will never have that happiness, because there will be a guilt factor. So never give way to that. So balance both. Do your best here, do your best there. And if you're doing your best both places, you will automatically get the support from outside also. And you can, move forward, and your evolutionary path in yoga, it's going to be smooth, without obstacles. Automatically, everything will be smooth. So your dedication is going to take you forward and nothing else.
And as a bride, you said the support you got from your husband, Sri Ramanathan sir, and from the great master, Dr. Ananda. So I think the husbands who are watching also should take the message that you should take a role model from Sri Ramanathan sir, like how he gave a support to Meena madam. So you should all also support your blessed wives and keep motivating them to go ahead in their ambitions in the field of yoga.
Yeah,
so nice. With this, we will come to the last part of it, the rapid fire.
Woo! We have a rapid fire. That's quite a surprise.
You would, even before we could start the session, you rapidly went to put off the fire, and came back. So you are used with fire. Women or somebody, you are yourself fire brands, and you are used with fire. So the questions are not going to be difficult.
Yes. And go ahead.
Shoot. Yes. Women.
Nari Shakti. Power.
Grihini.
Sorry?
Grihini, a housewife, Grihini.
Grihani, Nari, again Shakti. Shakti, Ghar ki Shakti.
Yogini.
Yogini. What can I say for that?
Meena, yourself.
No. I'm just thinking. Yogini is somebody who's selfless. That's what I would say.
Family.
Much needed support.
Society.
Sorry?
Society.
I don't know what to say for that. Good, that's all. Happy.
5-star.
5-star.
Ah.
Chocolate.
No, 5-star which you were showing to children and making them do yoga. So what it is, how is the response for Dr. Meena of 5-star?
I love chocolates too.
Oh. And Corona.
Goodness.
Post-Corona.
betterness, improvement, empowerment, self-empowerment.
The special children.
Pure, unadulterated love.
Seniors.
Guides.
The yoga day.
Awareness.
Very nice. Thank you. It was wonderful, spontaneous, and very relevant answers. And even the questions, just like what I think, I just say. I don't plan too much. I don't try to do a PhD. Permanent head damage.
That way it is more natural. Like people get to see what is you and what is me, and that's it.
That's it. So that was so nice. Thank you so much for joining with us. And it was a lot of insights which we were brought in, especially it's a beautiful area, what you have been working with special children. It's not so, easy to work in such a field. Of course, you had wonderful directions which you have been getting, and the perseverance you had, and then the passion that you developed towards these children, and the motivation that continued, that kept you go ahead more and more. The change that you could feel in them, that really took you ahead in going. And then I think many would be inspired in looking at this, and they would also, especially women, are made for such things, than what we do. Many women yoga teachers who are coming up can take up this as a specialized area. They can learn from people like you, and they go back and teach more and more, special children, and also the senior citizens. Both these are wonderful, they are so close to godliness. So
by nature, women are naturally more patient and perseverant than men. So men are a bit impatient when it comes to a few things. So perseverance and patience are somehow a stronger quality of a woman. So the tough things a woman can easily do. It's by nature, by default it happens. So all women who are aspiring to be yoginis, that is like it is going to happen naturally for them.
Very true. So that was wonderful. I think a lot of women are going to take you as the role model, and set their goals and walk ahead, march ahead. So all the best to all the Nava Yoga yoginis who are coming up, and we would again meet you all tomorrow with another episode 12. We're going to have Sri Rajendra from Melbourne, who is the head of the Vasudeva Kriya Yoga. Again, a very dedicated yoga practitioner who has introduced yoga even in the Parliament of Australia, and many works that he had been doing. A proud Indian who is there and spreading the wings of yoga all over. So we're going to meet with him tomorrow. And many yogic stalwarts are going to come in the days to come. Sri Shubodh Tiwari is going to be with us, Kaustubh Deshikachar and Guruji, and many people are going to join us in this session. So thank you all. Stay back with us for Kaapi with a yogini today and a yogi again tomorrow. Hope to have more yoginis come and join us.
Yes, of course. And thank you, Subbu Bhaiya, for this wonderful opportunity to have interacted with you, and through you with many other people. So as we all know, yoga is a journey inwards. So we are all in that path, inward journey towards self-realization. So may we all, with the Guru's blessings, may we all be able to proceed in that path, evolutionary path, and attain that, moksha. That is.
And today, Dr. Ananda Balayogi Bhavanani, who is your mentor, who is also a big brother for me, he had completed 75 days of continuous online sessions through the
Yes,
Facebook.
I wanted to mention that again, as I end. So it's that, the as I was saying, perseverance is a woman's quality. But with Dr. Ananda, it is never that. The dedication and sincerity, I learn a lot from him, because as a role model, we get inspired by our guru's qualities. So what he has done in the past 75 days is amazing, and that too, everything is done online, and he's been sharing so much of the theoretical knowledge, the traditional theoretical knowledge that is definitely going to help many people who are, aspiring to take up yoga as a profession, not just a profession, as a way of life, as a sadhana, as a way of life. So thanks to such people.
So I take this opportunity to, offer my pranams to him and many other yoga masters everywhere. You just on the Facebook today, you see lot many sessions happening, lot many webinars happening. So I think we are all trying to do the best what we could do, and that's what one thing which we have seen. Everybody are looking at the corona situation as a very positive outlook. So we continue to do that. Meet you all again tomorrow. Dhanyavad, namaste.
And Manjunath Bhaiya, thank you.